habari zenyu. Welcome to today's podcast. We call it Cara Care Roundtable, where we'll be talking about our health, especially as women and also as our families. With me on the show is our Cara Care Managing Director, Julia Migot. Karibu sana. It's a general discussion where we'll expect you to participate. So you're free to leave us a comment and reach out to us on WhatsApp maybe. I'll give you our numbers before we start the discussion. But for now, I'd like us to give a chance to our director, Madam Julia, to introduce the topic of today and then carry it from there. So, karibu mami.
Thank you, Irene. Thank you so much. Yeah, just like Irene said, we are very passionate about health and women health, to be precise. But that doesn't mean you don't touch on the whole family. I mean, when you talk about a woman, you know, that's a backbone.
Yeah.
Yeah.
A woman is the family.
A woman is the family.
Yeah.
So yeah, happy home, happy wife.
Yeah.
So yeah, so today we are going to talk about women health in terms of sexual health.
Mm-hmm.
Because in our day-to-day practice, we found that women, there's a lot of things that go around the womanhood.
Mm-hmm.
But nobody really gets to talk about it because women don't get to come out and due to embarrassment and all that.
Mm-hmm.
Maybe Irene, you can tell us what are some of the things, just even in your practice, that you've come across that women are actually suffering from every day, but they don't talk about it, or they don't know exactly where to go, they don't know the symptoms.
The most common thing that I've seen during my time of practice, when I talk about practice is dispensing, is most women suffer from yeast infections.
Yes.
And as we know, yeast infections can be caused by anything.
Yes.
And they've suffered trauma actually because most of their spouses or their partners do not understand the origin of this. And it becomes so bad when the woman also does not understand the origin. So today we are going to demystify the myths behind yeast infection, for example, because our fellow ladies, by the way, it's caused by so many things. Let nobody victimize you because you have a yeast infection.
You could actually even give us the signs, symptoms and signs of yeast infection.
So when you suffer from yeast infection, you have discharge, a yeasty smelling discharge from down there. You itch, and some of you will even have rashes.
You could maybe try and demystify for us the myths and misconceptions surrounding a yeast infection. And when you say yeast infection, what should women be looking out for them to know they're actually suffering from a yeast infection?
Okay. From the professional point of view, or the few years that I've dispensed and I've interacted with women who've suffered from yeast infection, like I said before, most of them do not understand the origin. Most of them think that it's a sexually transmitted disease. The truth about it today is a yeast infection is purely feminine. Let me put it that way, in layman's language. So our brothers out there who are victimizing ladies because of yeast infections, please stop. Today we want you to understand that it is feminine. Why am I calling it feminine? It's because of the hormones that we have. The women have estrogen and progesterone. And these hormones sometimes can vary in amounts. We call it pH balance. So this woman can sometimes be acidic and sometimes not too acidic. And every fluctuation of this can cause a yeast infection. Most of the times that women have yeast infections are around the time maybe they are closing up on their cycle. They're almost getting their periods. And my brother, you have intercourse with your wife during these times, yes, you get a sexually transmitted disease. But to her, it's a yeast infection. So please, I'd like to, first of all, pull you out of that and tell you that when you wake up in the morning and you realize your wife is smelling yeasty, and lady, if you wake up in the morning and you feel like, and you see you have a discharge that is smelling yeasty, you're itching for no apparent reason, just know that there's a problem with your hormones, number one. Number two, it can also be caused by diet, I guess.
Yes, even diet.
Yeah.
Diet can throw women off. Normally what I tell most of my clients who come with and they have yeast infection, first and foremost, they must also understand, like what you've said, the occurrences that happen for them to get a yeast infection. You know, if you're not putting on the right kind of underwear, because you see, if you put on underwear that does not allow, it's not breathable, then that of course makes the area very moist, and now it allows bacteria to thrive and to grow. That's why we encourage women to put on cotton underwears, and when you hang them outside so that they can dry properly. Another thing that I tell my women patients that also throws them off the pH balance that you've mentioned, is menstrual, the blood. The menstrual blood is basic, and down there we are acidic. You know, acidic to the extent back unaonanga somebody the panty. Yes, and that's actually very good. That's a very healthy vagina when it's acidic.
Yeah.
When it's acidic, that area, the pH there does not allow growth of bacteria. So the only thing a woman should always do is to make sure her pH down there is acidic. So blood throws us off. It throws a woman off, makes the area basic, because blood is basic. Makes it has a pH of 7. That's period. Especially when you're using pads and you're using them for too long, be rest assured you will get out of your pH will be imbalanced. What also imbalances women is semen. Semen is basic. So after intercourse, it's advisable that you clean, and it's also very good to clean with like an intimate wash. You know, most intimate washes are between 4.5 pH, so they're also basic. They're also acidic, sorry. So when a woman uses that every time that she's had intercourse, she takes back her vagina back to her. She lowers the pH of her vagina, because you see the semen is basic, so she has to lower it down to acidic so that nothing can thrive. So we've talked about semen throwing women off, blood throws women off pH, medicated soaps, those zimeandikwa antibacterial, those ones throw women off.
Wale mnatumia zile sabuni za kufanya huko kuwe brighter.
Yes, those ones throw women
very
off.
Careful.
Those ones for bleaching and things like that. Dawa, antibiotics throw women off, because now you get an overgrowth of bacteria. So you see, once we know what throws you off your pH, that is now the area that you need to start addressing. So anything that throws, even condoms can throw you off your pH, because there are women who actually react to latex, so they need non-latex condoms. So you, as a woman, you must really understand first what pH should down there be. Down there should be acidic. If down there becomes anything basic, any pH from 7 and above, that's going to be a problem. So what do you do? Because most of the time we don't know whether we are acidic or basic. You have to use an intimate wash.
And just to insist on what you're saying, Julia, like I said when we started, men blame women for these infections.
A lot of times.
But now you know, my brothers, that you are also one of the causative agents.
Thank you.
Yeah, you're one of the causative agents. So please, whatever you eat, make sure that you eat something that will also reflect well on your woman.
Yeah. It's very true. So women, yeast infection is very normal. Ukienda kutumia choo, be very careful about how you even use the toilet. Because public toilets also bring women quite a bit of this discomfort. And men should also understand that a yeast infection is not a woman who's not keeping herself well. They should also support these women.
It's when not about being faithful to you.
Yes, because that's also what happens. Men think that when you're getting a yeast infection, it's being unfaithful. And of course, women, talk to your men. When you're actually experiencing some of these symptoms, a yeasty discharge, it is card-like, sometimes it's white. We'll also talk about the other colors of discharge. Because discharge in women, every color means something.
Maybe you should just go ahead and tell us about it.
Okay, thank you. Now, okay, we've spoken about yeast. Yeast is the discharge. If you want to know, it's just yeast, which is, by the way, one of the most simple things to treat. Very simple. Just go over the counter, get some pessaries to insert if the discharge is too much. Get some cream to apply if there's a bit of a rash and an itch, and of course get some oral tablets. That should be able to sort it. So yeast discharge is a card-like, not smelling. It doesn't actually have a smell. Could be yeasty, like what Irene says, and there could be an itch or not, but sometimes the discharge is a lot. But predominantly the color is normally off-white. So you should always be very careful as women of the color of discharge. And of course, there's now, that's yeast. Now when we go to vaginosis, yeah, that one is caused by a protozoa. It's not bacterial. Yeast is caused by fungi.
Yes.
The vagina is also affected by protozoa. Protozoa is what causes a condition called Trichomonas vaginalis. Trichomonas vaginalis is there's a frothy discharge. Frothy kama iko na, unajua ile kitu watoto wanafanyanga, that's bubble.
Pofu.
Yeah, pofu. Yes.
Ile ya omo ile.
Kama ya omo. So iko frothy and it is clear, but it has a very distinct fishy smell. That's Trichomonas vaginalis, and it can.
Now, when you say fishy, inanuka samaki ama?
Yes, inanuka kama samaki, omena, something like that.
Ladies, anyone smelling like omena, please?
And there's froth.
Listen to this.
And there's like this discharge with kama yo povu.
Yes.
It can really be very uncomfortable because the itch is out of this world. It is very itchy. That one, of course, you use some protozoa. So majorly you go into the likes of metronidazole, flagell. Those ones are really quite, and depends on your dosage for flagell will depend on the level of infection. Because sometimes maybe umekanayo sana, the discharge has become too much and the smell is just too much. Yeah. So, and then of course some of these tests you can get them. You can go diagnose. This is a clinical diagnosis, but you can also go into a lab and get run a test, do some urinalysis and things like that. So there's Trichomonas vaginalis caused by a protozoa, which of course we say we use most of anti-protozoa products. But by and large, you still have to use some cream to reduce the itchiness, and maybe even some antihistamine if the itchiness is too much. And then now we have yellow discharge. Yellow discharge is called yellow or green. It starts as yellow and then it goes to green. Yellow is the ikianza. But saa zingine watu huanza from yeast, but because they don't treat yeast properly, it graduates. Now you get a secondary bacterial infection from the primary yeast infection. So what happens? Now your discharge that was now initially off-white starts becoming yellow, and then it becomes green. I'm sure have you guys ever seen yellow or green discharge?
Yeah.
Yes. And that time the smell is even dem akipita tu hapa
unajua
unasikia tu harufu.
Nasikia tu samaki ya kutembea imepita.
Yes. And normally this happens because women are not told early. Women are not educated enough to know early enough to know that if it is, I can just treat it alafu iende. Watu anafanya akipata yeast amenyamazia kabisa, anafikiria amepata HIV, anafikiria amepata ugonjwa zote, STI zote, gonorrhea, syphilis, name it. So when night graduates to bacteria, bacterial infection, it becomes bacterial. The infection is called bacterial vaginosis. That one now.
Yeah. Bacterial
vaginosis. This one is characterized by yellow discharge, very itchy, very smelly, and then if you left untreated, of course graduates to green discharge. So green discharge is a time that women are put on mixed. It can even be called a mixed vaginal infection because sometimes she has yeast, she has protozoa, she has bacteria. That's now takes us to the essence of now the kits, the VDM kits, the trial kits that women are using, because now the infection has gone ikakuwa so mixed. Even at this point is when you can also transmit it to your partner.
And so now talk about the transmission. Now,
yes,
this lady has ignored all these stages. She's not taken care of herself. She's not taken the medication, and now here is the partner coming into the picture.
Now this.
So what happens here?
This is the